Okay, and we're live. Here we go. Alrighty, everybody, welcome on our Facebook Live. We're coming to you on Talk Recovery Radio. I'm in studio. We've got Scott on the camera right now. We've got Deb, who are going to do a personal story. Here's Francis. Say hi, Francis. Alrighty, thanks for joining us. And we should be live. Well, we are live already. You got your headphones on? You good to go? Alright. Okay, microphones are going on. Ooh, almost forgot my microphone there. Hello, everybody, and welcome to Talk Recovery Radio. We're coming to you live from the Vancouver downtown east side on Vancouver Co-op Radio, CFRO 100.5 FM. Thanks for joining us. I'm here in studio with my co-host, Francis Stone. Hello, Francis.
Hello, Giuseppe. Hello, everyone.
Hello, everyone. And Darren is, I think Darren just got here. I just saw him on this. We've got really high-tech security here, and I just saw him on the camera, so I think that was him. Anyway, so we are live every Thursday, and thanks to everybody on our Facebook page who's watching us on Facebook Live. We're in 4.5 years now of doing this show every Thursday, and we thank all our past guests. If you're interested in being on Talk Recovery, you can just go to our Facebook page, facebook.com/Talk Recovery Radio. Darren, come on in, Darren. Everybody say hi to Darren.
Darren.
We're live on the radio. Hey. I know traffic parking is so bad when it's raining down here in the downtown east side, but we end up getting a parking spot. So we come to you live on Thursdays, and we bring addiction and recovery issues to the airways. And we usually like to talk about a couple of hot topics at the beginning of the show. And for those of you that are local here, last week was an awesome weekend for people in recovery. There were 2 roundups. For those that don't know what a roundup is an AA kind of convention where people in recovery get together and we can recover, and it is possible. And so if you have a loved one out there that's using, or you're just you're using, or you're confused, and don't ever give up. Like, recovery does work, and there was thousands of success stories at the convention center last week. And I wish we could do roundups every week. You went, Francis?
Yeah, I went.
Yeah, we had a good time. I was kind of doing both. I went to both conferences, and I had a great time. Another big hot topic, I don't know if Darren caught it on the news, but and I was corrected. Nurse practitioners can now prescribe hydromorphine to their patients, and they're calling it ease access to treatments, and it's to help save lives, and it's helped to increase opportunities for people with severe substance use issues to get medications rather than using illicit drug use. I'm kind of impartial to the whole thing. I think it's pretty easy to get Suboxone and prescription medications. I don't know what province people live in where it's difficult to get medication. Like, it's super easy in the province of British Columbia to get any type of medication. So I'm not too sure why there's a need to increase the ability to access medications. I'm really hoping that people understand that recovery capital is part of the assessment process when somebody has an opioid addiction. I don't see much of that conversation going on. I don't know. What do you think about it, Francis?
I'm just kind of curious. This is the second thing that I've heard of nurse practitioners kind of stepping up and filling the role of a doctor, and I'm just kind of curious about what is sort of happening there. That's my curiosity around it, because we all know we have a shortage of doctors, and I just wonder if there's something happening where more responsibility is going towards nurse practitioners.
Yeah, but you say we have a shortage of doctors. Like, if you're a family looking for a physician, yeah, you're right. There's a shortage of doctors. But if I'm a person with substance use disorder, I can go to any clinic in the province of British Columbia, drop in, and get a Suboxone prescription in 30 minutes flat. Right. Like, I it's that's the truth.
But that's the problem. Is that, yeah, it's really easy to go to a drop-in clinic, but it's not easy to get a family doctor that there can be all your paperwork in one place.
That's the problem. You're right.
There
there isn't that full continuum of care. So we're going to bring some nurse practitioners on the show, and we're going to have a conversation, and maybe we'll get some hydromorphine while we're on the show. I'm waiting to figure out what do you mean joking? No, I'm joking. I am joking, but why not?
Just like they had too much coffee or something.
I'm just really interested. I love the fact that we're progressive enough to keep benefiting the services for people that have substance use disorder. I just really cautious that are we really looking at all the factors? It's like, okay, great, nurses can give hydromorphine to people that are addicted to opiates, but what else? And then what? And that's the thing that we're not doing. And then what? We had easy access to methadone. We've had easy access to Suboxone. And then what? And then what never gets taken care of. It's like we keep fixing these problems with these little band-aids.
Which is new, is disability forms for somebody to have a disability or whatever, apply for disability. And so I'm curious what's happening there. That just makes me really curious.
We'll figure it out. Well, thank you. That was our little conversation for Hot Topics. We're over time for our first guest. Francis and Darren are going to be interviewing our first guest today. Francis, who do we have in studio? Who's on the show?
So today we get to talk recovery with Adele Kafer. Did I say that right?
Yes, you did.
Awesome. Welcome to Talk Recovery, Adele. And you are going to talk about cranial sacral therapy?
Yes.
Yes, I said it right. Okay, so what is that?
Well, cranial sacral therapy is a light touch therapy. So I do touch people. They lay down on a massage table, fully clothed, and I'm touching mostly their bone structure. And I work with bones, meninges, and fascia. And that's aiding the body into its own natural healing ability. So what I end up doing a lot of the time is anxiety is very, very common. So I have a particular way of helping people with anxiety in a particular spot on their vertebrae and their back while they're laying there that I'm just touching with my hands. So it's kind of, and it's some energy component to it as well. It's not just physical therapy. And sometimes there's some talking involved if there's emotional issues. I do like to sort of fess some of that out to help people in the best way possible.
So when you say it's touch therapy, so is it like, so say if you're doing my wrist or something, would it be like just touching the vertebrae?
It would be about this kind of pressure. So there can be more of a pressure to it. It depends on how tight the vertebrae is.
But it's not like a massage.
No, so I'm not moving around. I'm staying stationary until I work my way all the way up your neck until I get to your atlas and axis. And then I'm holding your head and I'm helping you with headaches perhaps or
and so
any other.
While you're doing this with a client, you're talking about like, are you holding any stress or like, are you asking those types of questions or?
Oh, I do a very in-depth intake with people, so I do find out what they're there to see me, what is their major complaint, and we go through those types of things, and I do ask them things about the stress in their life, big and on the table at the moment, if people have changed jobs, or they are in recovery, or they've just been divorced, or things of that nature.
Do you have people come to you that are struggling with addiction?
I do, yeah.
And so what would be a common complaint? They're maybe struggling with anxiety and then they're trying to self-medicate for the anxiety? Like, would you treat the anxiety or would you treat the addiction or how would that work?
Well, I don't often, it's not really caused them to relapse, perhaps.
And so does it last? Like, so a client comes in, how long is a session? Like an hour?
It can be an hour or an hour and a half.
Okay.
I have right now a special, so you get 90 minutes for the same price as 60. So in that time, I can take care of quite a lot. And what I like to do in there is do my protocols, do the spine, do the head bones, and I do mouth work as well. And what that all does is it unwinds everything in the body, all the bones, and it helps you with your nervous system when I do that.
And how long does that last?
Well, that's That's hard to say. It depends on the person. It depends on how bad their anxiety is. I mean, if they're just amped right up, I might have to see them a couple of times a week. Although some people find once a week is fine, and it can only be for a certain amount of time, and then they're okay again. But then if they have a big life stressor come in, something new happens, then they would call me up and come back and see me for another couple visits.
So how did, I'm just curious, because I think a big part of my recovery was even sort of rediscovering touch in a healthy way. So that touch is not something that, something sexual, like, all the time, right? And so is that a component that people come to you with, that they're maybe not comfortable being touched, and then you help them, like, ease into that comfort?
Yes, that is a big one. There are lots of other abuse issues that go hand in hand for people. They have multiple issues. They have physical, they have emotional, they have, maybe some type of sexual abuse in the past. So what I work on with them is gaining their trust, helping them recover in a very safe place. And that's something that I do relatively quickly with someone when they have disclosed those types of things with me. And I always just have to ask people, is there anything else you want to tell me? This is all confidential. This doesn't go any further. And, it's just going to help me be able to help you faster.
I think that one thing that people have shared with me is that sometimes they can feel emotions come up when they're new in recovery, and they're so scared of that emotion that they just want to run, leave whatever situation they're in. Do you ever have somebody that gets up from the table and leaves, or is like, okay, stop, I feel overwhelmed with emotion or anything?
No, I've never had that happen. I've wondered about that happening. However, it never has. When I have a sense of someone having some higher anxiety and trust issues, then I have that longer intake with them, and I do, I get to know them, excuse me, and I talk to them for quite a while, and while they're on the table, we're still dialoguing, if that's appropriate. So I have a way of setting people at ease, physically and emotionally, and people open up to me and tell me things that they say they never tell anybody.
So do you fit the role of a counselor as well? So people see you once a week, and then do you sort of serve both roles as it's kind of like, I think of it as kind of like how you're a hairdresser, you're getting your hair done, but at the same time, you're talking about your life, and you're, connecting.
Absolutely. I wouldn't give myself a counseling certificate of anything. I'm a cultural anthropologist as well, so I have a really good background in my education when it comes to people, culture, human behavior. So that is really helpful. I also have a lot of people in my family that are actively using, and one sister that's in recovery and just got her 5-year cake. So, I'm no stranger to that aspect of it, and abuse issues and whatnot. So it really helps when you can talk the talk and walk the walk at the same time with people, because they get a sense, they can understand right away that they're not talking to someone that has no clue about addiction or abuse or any of that stuff. They know right away.
They've found the kindred spirit.
They found a safe place, and I find they relax, and lots of times they fall asleep on the table, and they always apologize for that, but I tell them that's the biggest compliment you could have paid me, was to just fall asleep. Well, you've never met me before, and you've come here, you've fallen asleep, you told me your secrets and all the things that really haunt you and bother you, and here we are. And then they leave feeling relaxed and great, and usually quite surprised. I do a follow-up call about 4 or 5 days later, and I ask people, how are you doing? How was the treatment? What are you feeling like physically? Anything you want to talk about? And they do share a lot at that point. And I think it's a pivotal part of my practice to do that with people. Gets more trust happening as well. And they know that I really do care about their recovery.
Nice, I like that.
I was just wondering on that topic, what's your scale of measuring someone's anxiety or someone's stress? How do you gauge that?
Well, I did go through a really high anxiety period in my life. So I had different stages of that. So I asked people point blank, I go, are you like so amped up right now that you can't even leave the house, and you get so amped up and you're up like that for days, and then you crash and you're just exhausted and you can't move? Is it that kind of anxiety? And then they look at me and they go, well, no, I have been there. And then they describe another part of the anxiety where they're just social anxiety, right? They can't go out, they don't trust themselves in front of people and whatnot. So I get them to really let me understand where they are. And I tell them, I have been there. I do know where you are. And I tell the very high anxiety people that they can call me anytime, which is not something I do for every client, but anxiety, I do. I let them call me if they need to.
Wow. So how many sessions, like let's just say somebody has a typical stress and anxiety level, they have some insight as to where it's coming from and whatnot, and they're just looking for another way of lessening it. How many sessions do you recommend? Is there a set amount, or do we just sort of keep going until someone feels that there's no point anymore? Like, I mean, I think that sometimes it's like I go to a massage or a chiropractor because there's a problem right now, and then there's this idea though of continuing to go on a regular basis, sort of for upkeep.
Right.
Is that same type of theory?
It can be. It depending on someone's anxiety level, right? Like I say, I've treated people 3 times a week. I've treated people once a week, twice a week. It depends where they are. And then what I like to do is I like to talk to that person, and I like to find out if they think they know what the anxiety is all about, and see if there's anything else in there that maybe they haven't really quite thought of that could be part of it. And so then, I may say to them, if it has to do with work, if it has to do with returning to work after an absence, and they're freaked out whether or not they can do it after they have been away for so long. Really typical. So, I let them know that they're going to be okay, and I would talk about how they've progressed and how they don't have that anymore, and how now they're sleeping, right? So I like to get the sleeping under control right away. That has a tendency to really calm people right down when it comes to anxiety. So it's not really a set, but I say to people, you probably are going to need to come and see me 3 or 4 times, and then we'll see how you're progressing in it. Right. And if I don't see that progression with them, then I suggest another type of therapy or another therapist, because sometimes it's the therapy, sometimes it's the therapist.
Right.
So I always like to talk to them about that. I have had successes with people, and like I said, the checkup thing, that can be every 3 months. Okay. But if it's really high anxiety, I just tell them, when you feel yourself starting to amp up and you know that internal feeling, then come and see me. And I give them some tricks. I mean, some people are tactile, some people like touch, some people like feeling, some people like talking. So I tell people that are very touch oriented to keep soft velvet in their pocket, something. And if they're starting to feel that way, then they can touch the velvet right away, or like a cat or something, right? Yeah. So
put a cat in their pocket.
Yeah. Awesome. If they could just only do that, right? Because that helps people.
That could start some rumors. I'm curious. I saw on your website that a lot of your clients had given feedback on your website and said that you had very healing hands, and that they were able to reduce trauma through these sessions. So what does it look like to release trauma?
Well, when I'm touching someone and I'm touching part of their spine, and then they're telling me about, like they've already told me about something that's been traumatic or something, and then or they haven't told me, and I'll say, I felt some sort of fear. I have a medical intuitiveness about me that's not on my website, but I'll say, I'm sensing some fear, and I'll say, well, what was your biggest fear as a child? Because I'm feeling... And so someone disclosed to me that it was nightmares as a child, and they were quite terrible. So we talked about that, and when that was happening, her vertebrae really started to do this therapeutic pulsing, so it feels like a heartbeat in there. And they were really pulsing, and I said to her, keep talking, because right now we are helping this problematic area of your back, because we were talking about this issue.
Right.
So that's, you know, for everybody it's different, it comes up, but I have a sense when I'm somewhere that there's something here that we do need to talk about.
It's so cool that you can actually feel
Wow.
the release. I mean, people say it, like I hold my stress in my shoulders, or, you know, anxiety. When I think of anxiety, it's in my gut.
Yeah, often.
You know, and it's just a saying, right? Because you sort of sense it there, but there's actual truth to that, you know, and how much, you know, how much our energy when we're sort of, you know, unresolved and suppressing emotions and things like that, like how it manifests itself in a physical way. So, like, I'm thinking of, you know, some of those diagrams of pressure points on the feet, you know, press here for the gut, you know, on the toes for whatever, like, I don't know, but is that what we're talking about here in the head and neck and face kind of thing? Or are they pressure points that you're looking at?
I don't exactly
call
them, you know, pressure points, because what I have to do is I have to work the whole area around the back of the head where your head meets your neck, right? So there's that little kind of indentation area. So I just feel around, and sometimes I have to hang around in there for quite a while before I start to feel something release, or I get the person talking to me, because I'll be thinking, okay, I'm gonna have to ask them some questions right now. I'll say to them, so what are you most worried about? Like, what would you call your biggest thing, right? Because they may think it's one thing, but yet they're like, wow, you know, I didn't really realize, I never put that together. Or they haven't put 3 traumatic events together that have brought about the anxiety. It wasn't one, there was 3, right? And it actually started when they were a child, right? So that kind of thing as well. So that can be pretty surprising. And that's, I mean, anyone can just look at that and see a timeline happening there and think, okay, right? So you don't have to be a counselor to see some stuff, right?
Yeah.
So it's quite experiential, and it's energetic too. So some of that stuff that I feel is very energetic, and the person on the table may or may not feel it. Some people do, and they go, why, if you're touching my head, why are my feet going crazy?
Right.
Why are they tingling? And I go, well, that's cranial sacral.
Yeah.
Right?
And as you say, you know, you talk about these releases of emotion, of whatnot. You must get people that just absolutely lose their mud, so to speak, on the table. I I think back, I know I've done, you know, some work with all types of therapies and touch therapy and things like that. And as soon as somebody has their hands on me, that's not in like a, fix that knot in my neck kind of way, like there's an emotional release there. Does that happen a lot? I mean, where just people they get to, you know, let it out, so to speak?
Yeah, there's several ways in cranial sacral. It's not the same as just talking or crying or what.
Right.
Some people laugh uncontrollably. Some people start coughing, or they're swallowing a lot, and they're like, I can't, like, I don't know what's happening, but I just and I said, that's okay, that's normal. So I get crying, I get coughing, I get laughing, sneezing. Some people have little body twitches too.
So is it like a detox in a way?
Well, cranial sacral is it is very physical too, what ends up happening, even though a lot of what I do is energetic plus physical. But when I release an area, if it's tight, and muscles are like this, so when I take stress out of the bones, then the muscles, ligaments, and everything attached to it can get in and out. And healing fluids. Yeah. So essentially, I just take a congested area of connected tissue and I allow it to have the healing that the body knows how to do. Right. I don't actually heal anybody. I just guide your body into healing itself. And it's amazing, and it's absolutely a privilege to feel that happening. It's cool.
That sounds really cool.
Is
Yeah.
it something that people come to you for even like weight loss and stuff like that?
Oh yeah, definitely. That's one of the things as well, because once you're calming down someone's nervous system and they leave feeling so calm and so de-stressed, and they say, I'm so relaxed, and I say, that's how you're supposed to feel all the time. But we don't. We live in this society where it's go, 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 do, drive, work, especially here. And, you know, there's a lot of pressure on people. So when they feel that feeling of relaxed, it feels very foreign to them. And it's like, I was thinking I was putting people into this. No, all I've done is restored them to a normal, natural feeling.
Right.
Wow.
An emotional feeling.
Well, and you as you describe that, like, you know, I think about how and when I make the healthy decisions, and, you know, when I crave sugar and just eat unhealthily, like, you know, it's usually underlying stress and anxieties and things like that. So when and if I can, you know, be guided into a sort of a calmer state, then I may not make those impulsive decisions.
That's exactly what it does. Exactly. So whether that's overeating, whether that's drinking, whether that's using drugs, you know, caffeine users.
Yeah.
I mean, right? They're doing it for energy and to keep going on not a normal level. So, you know, that curbs all of that for people.
That being said, do you recommend, you know, not having a coffee on the way down to your session?
Oh, yeah.
You know what I mean? Is there a protocol of, like, have a glass of water, relax prior to coming in?
Well, everybody has to stay more hydrated, and as soon as I touch somebody, I know if they drink water or not. I can tell them right away. And they go, oh yeah, I don't. And then so I tell them after they leave, you have to, after every body therapy, drink a lot of water. People have moved toxins around and got everything moving now, so you need to help your liver. You're always needing to help it, because otherwise the same dirty water just rolls around over and over again, and your liver can't do anything about it.
And where can people find out more? Where's your website?
It's www.cranialsacraltherapy.ca.
Awesome. Thanks so much for being on the show today, Adele.
Thanks for
It's been a
having me.
pleasure. I've learned so much. Thank you for watching Talk Recovery and listening to Talk Recovery, and we're going to go to our first song.
Yeah, Co-op Radio, CFRO 100.5 FM, and coming up next on Personal Story will be Deb and Scott. They're in the studio right now helping us out, so stay tuned, and let's go to our first song, Give a Little Bit, by Supertramp.
Alrighty, thanks for joining us.
I don't know why I even got nervous about that.
Oh, yeah,
that was
I
great.
still do.
You guys are great.